Traumatic brain injury or post-concussive syndrome is unfortunately a very underdiagnosed cognitive pathological condition in personal injury. Oftentimes, diagnostic imaging, neuropsychological testing, and/or cognitive therapy are relied upon heavily for the diagnostic and treatment purposes of the client. While these studies and experts can certainly help diagnose the injured person's condition, there is typically one very important clinical presentation or manifestation that is not discovered with all of this testing. And that is how the brain injured individual is functioning in quote unquote real world environments, promoting the ecological validity of an evaluation. The ecological validity differentiates how generalized experimental findings are relatable to the real world, such as situations or settings typical of everyday life. Think of ecological validity as a subtype of external validity. This is where the cognitive functional capacity evaluation, or COG-FCE, comes into play. The COG-FCE evaluates an individual's functional and cognitive capacity in relation to their ability to perform essential critical job demands with a focus on the intersection of physical, psychological, cognitive, and behavioral implications of an injury or medical condition. The COG-FCE includes the formal standard functional testing such as range of motion, strength, mobility, limb coordination, postural tolerances, etc., in addition to a standardized assessment of cognitive function. These assessments are both component and performance-based tests, non-standardized assessments, structured observations of physical, cognitive, behavioral, and even psychosocial functioning. The evaluator has the unique opportunity to evaluate executive functioning skills, both practically and formally, by using the clinical environment and environmental demands as in addition to measuring the evaluee's performance. This form of environmental evaluation is a very useful and relevant quantified assessment to determine the functional capacity for employment and/or how the evaluee's cognitive deficits affect their ability to perform activities of daily living and leisure activities as well. This approach highlights ecologically valid measures of work-specific tolerance, particularly in areas of attention, activity tolerance, mental stamina, and even executive functioning. Make sure your cognitively injured client's impairments are properly documented to essentially show how they affect their livelihood.